Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everybody. Thanks for tuning in. Our guest for today's show is Kelle Logan, who has a lot of good gems to share with you regarding a treatment modality that not a lot of us are aware of. And we had to postpone the show for a little while for various reasons. One was my own personal healing journey. As always in chronic illness, we might get some dips in there. So working on restabilizing, but we didn't want to delay the show any longer. We're never promised tomorrow, so at any moment when we're feeling we have a little bit of energy, we can get the information out there. We definitely want to jump to that occasion. So without further ado, welcome to today's show, and I will be introducing our special guest, Kelle Logan. Kelle Logan is the owner and founder of Novel Mind and Wellness Center. She's been practicing as a nurse for over 20 years, and she has a wide range of experience in critical care. After graduating nursing school, she was a registered nurse in the cardiothoracic surgical ICU at the University of Florida Shands Hospital. She advanced her career and was a heart transplant ventricular assist device coordinator at the renowned Tampa General Hospital. She received her master's degree in anesthesia from the University of South Florida and has been a board-certified registered nurse anesthetist for 10 years. She graduated with honors and president of her class. Ms. Logan has also been a speaker at several national conferences with a focus on end-stage heart failure and anesthetic considerations. As a nurse anesthetist, she worked at Moffitt Cancer Center in Tampa, Florida, providing anesthesia to oncology patients. In 2014, she relocated to Tallahassee, Florida, where she has provided anesthetic services for Tallahassee Memorial Hospital, Capital Regional Medical Center, and Archbold Memorial Hospital in Thomasville, Georgia. Mrs. Logan was the chief CRNA at a local pain clinic which concentrated her anesthetic career to chronic pain patients. She was also the director of a ketamine clinic and has performed well over 4,000 ketamine infusions for chronic pain and mental health safely. Mrs. Logan is further expanding her knowledge base and has been accepted to the FSU Psychiatric Mental Health Nurse Practitioner program as of fall 2023. She is enthusiastic to combine her extensive knowledge of anesthesia and chronic pain with mental health to provide the best care for her patients. Thank you so much, Kelle, for joining us today. We are so looking forward to this conversation with you.
Thank you, Sharon. I'm excited to be here. This is an amazing opportunity for me to provide education and to promote this life-saving treatment because I get to watch it change lives every day. So I'm excited to talk to you today.
So we'd like to begin by getting a little bit of background in terms of what brought you to this field and the types of clients that you generally serve.
I am a certified registered nurse anesthetist. I have been doing anesthesia now for almost 11 years. I've been a nurse for 20. My original background was in cardiac. I was a cardiothoracic ICU nurse, and then I was a cardiothoracic and transplant coordinator, and I worked with the patients with end-stage heart failure. Briefly after that, I decided to go back to anesthesia school. It's kind of ironic where I've ended up. I didn't ever plan to do ketamine. However, this is a life-saving treatment. It has saved my life, and now I feel home here. So I ended up doing some chronic pain management at a pain clinic and was doing anesthesia for those patients. And I still saw so many patients who were having a hard time managing their pain and their chronic illnesses, as well as their depression and anxiety, PTSD. And so I started looking into the opportunity of possibly opening a ketamine clinic and what that would entail and how do you treat patients with ketamine. In the meantime, I was actually offered a position at a local clinic here, and I had been working there for the last 2.5 years and recently left, and I have now opened my own clinic.
Very cool. For our listeners who may have heard the term ketamine, can you give a little bit more of a background on what it is?
So ketamine is an anesthetic agent. We use it a lot in anesthesia, especially for chronic pain patients. We also use it a lot to sedate children to be able to start IVs. It is a fantastic anesthetic agent, but it does have some side effects. It was originally found in the 1950s, and it was used to sedate horses. A lot of people equate it with the horse tranquilizer. Yes, it was used for that. Yes, it was used very successfully. And so when the Vietnam War came around, they were looking for something to help sedate injured soldiers in the field. And so they started using ketamine, and it worked perfectly. After the Vietnam War, they started treating chronic pain in veterans with ketamine. And what they found was not only did their chronic pain resolve and get better and improve, but also their shell shock improved. At the time, we didn't know what PTSD was, so we called it shell shock. And not only did we watch their pain improve, but now their anxiety, their PTSD was also improving. So there came the premise of, if we were giving these high doses of ketamine for pain, why don't we try lower doses and see if that helps their PTSD and depression? And it did. So ketamine has been used for many years now to treat anxiety, depression, PTSD, chronic pain. And I would say in probably the last 3 to 5 years, it's really come to the forefront as more of an accepted modality and treatment plan. And especially the last 2 years, I've seen a huge shift in the openness to even try ketamine and talk about ketamine.
I know that it treats a wide variety of the chronic pain conditions.
Yes.
Some of our listeners, they deal with chronic pain from, I guess you could say, traumatic surgeries. They also deal with pain associated with conditions like dysautonomia, that's POTS, even things like mast cell activation syndrome. So I wonder if you have any experience with patients coming in under those type of syndromes, depression that comes along with chronic illness.
I do. That would be the majority of my pain patients. Most of my pain patients have been there, done that. They've tried multiple treatments, multiple medications, and they are still struggling with either chronic pain or depression and anxiety. Basically, they're kind of at the end of their rope and they need help. And so that's typically when I come in. A lot of my patients have POTS. I have seen that. A lot of my patients have autoimmune disorders. One of the most common things that I treat, which is not a common syndrome, is complex regional pain syndrome. I see quite a few of those patients, which is an autoimmune disorder that attacks the nerves in an extremity. And any type of nerve pain, so that burning, stinging, tingling, so fibromyalgia responds very well, intractable migraines, any type of neuralgia or neuropathy, trigeminal neuralgia, occipital neuralgia, and one that sometimes people don't even think about, post-herpetic neuralgia from shingles. That pain can be debilitating, and typically it happens in patients who are 70 to 80 years old, and they can have horrific pain in their trunk area after having shingles. And so I also see that quite a lot and treat that as well.
It's amazing that you've been able to support that variety of patients, and specifically, I hadn't heard about it helping people with POTS, people that are struggling with both orthostatic hypotension and hypertension. Have you had clients on both ends of that spectrum and seen any different impacts when they receive the treatment?
So typically what ends up happening is I usually, for those patients, give them some fluids to make sure that they're well hydrated. And those patients tolerate ketamine very well. As far as treating the actual orthostatic problems with POTS, it doesn't necessarily do that. However, it does reduce their anxiety significantly.
Yeah, I do understand that the anxiety component, especially as you mentioned, this might be, they've seen 15, 20 specialists. They're exposed to what we call gaslighting communities, where their diagnosis is not really something that's treated directly. They come with an indirect approach. A lot of people that I've spoken to have received an anxiety diagnosis, but no treatment options other than pharmaceuticals. So it's fascinating to me that this avenue is one that can be approached, but how can we get people the information to know about this and to know that it can indirectly treat a myriad of symptoms they're experiencing?
I think the first thing is education and letting people know that we are in the community. Also letting patients know that I have performed over 4,000 infusions safely. Ketamine is very safe. Are there some risks? Absolutely. However, we will go over those. The biggest risks with ketamine are increased blood pressure. So we monitor your blood pressure very closely while you're under these infusions. Increased heart rate. We monitor your heart rate the entire time, your oxygen levels. But ketamine is very safe for even very sick patients. And I have quite a few patients who are extremely sick and have multiple comorbidities. And again, have performed over 4,000 infusions safely. And I have even undergone this treatment myself. So I think the biggest thing is trying to get more education, doing more podcasts, more interviews, as much as I can to educate the community that this is here and it is available. And it is a viable, excellent treatment option.
In the beginning, you mentioned that ketamine was actually something that helped save your life. Can you elaborate on that?
Sure. So when I first started doing ketamine, I was not necessarily trained in what I was going to hear. Obviously, I'm an empath, so the first thing that I do is try to comfort and help someone. And under ketamine, you can have a lot of memories, especially my PTSD patients. They can have a lot of memories and things come up. And so patients started telling me about all the things that had happened to them, and I started carrying those things home with me. So that became very difficult. In anesthesia, my job is to put patients to sleep, not necessarily listen to them and talk to them and comfort them. And so I had to readjust my thinking and receive training so that I could listen to those things and not take them home and let them affect me. The problem was, after about a year of that, there were other life stressors that were happening with me. In about a 5-year period of time, my mom passed away suddenly from a stroke. I took care of her, took her home and took care of her until she passed. Then I had my son shortly thereafter that. My dad's house was destroyed in Hurricane Michael. He lived in Panama City, and his house was pretty much completely destroyed, had to be rebuilt. Shortly after that, I had a miscarriage at 18 weeks. That was very traumatic, and it ended up with bleeding and ended up having to have a emergency surgery. And after that, my son was diagnosed with autism. And then I got pregnant with my daughter very quickly thereafter. And there were a whole lot of stressors and anxiety. And I'm pretty certain I had some postpartum anxiety and depression after the miscarriage for certain. And then I was pregnant so quickly thereafter. I was too scared to take anything, too scared to do anything. And so I had switched jobs as well and started working at the pain clinic. And then I started working at the ketamine clinic. All of those life stressors, and then coming in every day and hearing all these things that had happened to patients and trying to help them and help them through it, it ended up taking a toll. The final thing that happened was my husband had my 42-year-old healthy CrossFit running husband had a heart attack in November of 2021. And yes, ended up having a quadruple bypass shortly after that. And so that all happened in November. And by January, I was falling apart.
Incredible amount of stressors, like you said, in all fronts, emotional, physical.
So I decided I had actually looked into doing ketamine therapy after I had the miscarriage. And fortunately, I became pregnant with my daughter so quickly thereafter, but unfortunately, I was unable to be treated, and then I refused to take anything at that time. So I was not able to do ketamine. And when January rolled around and I was not doing well, and I recognized I was not doing well, I was functional, I could go to work. However, I was severely anxious. You would not know. I would be sitting here just like I am sitting here talking to you, but I would be crawling out of my skin and crying all the time. Any second I had, I was crying. I decided to undergo ketamine treatment, and it completely changed and saved my life. During the course of ketamine, I also did intensive therapy and restructured my thinking and how I approach things and how I cope. And that also changed and saved my life. And I am so grateful to have had that opportunity. I think that number one, as a provider who has struggled with PTSD and as a provider who is providing the ketamine, it has made me significantly better at caring for patients because now I understand and I know what they're going through and feeling. And so I can guide them through that much more efficiently me, and I can tell them everything to expect and also let them know, hey, I've been there too. I understand. You're not alone.
So many hidden gems that you just brought up. The key thing, I think, is that you experienced it yourself. And so you're sympathetic towards the needs of all of your clients. I think that's one of the most comforting things when I go to a practitioner and I know that they've been on both sides of the spectrum. It makes a huge difference to me. And
Absolutely.
knowing the care that you provide is centered around your own hardships that you've endured.
Absolutely.
So client who comes in to see you, sure, you have a process laid out very well to kind of guide them along. Can you talk us through your process of the intake and then how they would get into a nice protocol?
So typically what I do first is bring a patient in for a consult. If they're not able to come in, if they live several hours away, then I can do a Zoom consult with them that's HIPAA compliant, because I want them to see the clinic and I want them to see that this is a space where healing happens. That's very important to me, that when you walk through my doors, you feel comfortable, you feel safe, and that you know you're in a good environment for healing. Set and setting play a huge role for ketamine, and feeling safe in the environment and with the provider that you are with providing your ketamine is a huge component to how you respond and how you do. So I have taken all of that into account, and every little detail that is here has been methodically thought out so that patients do feel comfortable when they walk in here. They do feel safe and they know that they're going to get the best care possible. So the first thing that I do is a consult. And so I would bring a patient in, and I typically spend anywhere from 30 minutes to an hour with them. And I go over all the risks, the benefits, the treatment course. For anxiety and depression, it's typically a 45-minute to an hour infusion. And then I keep patients 15 to 30 minutes afterwards to make sure that they're okay. They're not having any nausea or anything or a headache afterwards, because we would treat that. And they do have to have a ride home, so someone would have to drive them home. You cannot drive them yourself home. The pain patients do either 2 or 4 hour infusions. So they're typically here for 3 to 5 hours, depending on if they're doing a 2 hour or 4 hour infusion. It also depends on their diagnosis and how their pain is as to whether or not I do a 2 or 4 hour infusion. And typically, I do start with a 2 hour for most of my pain patients. If they are a complex regional pain syndrome patient, then I will do a 4 hour infusion, and I will go over that with them and the protocol. So for depression patients, it's typically 6 to 8 infusions over 2 to 3 weeks. And then my pain patients are 8 infusions over 3 weeks. And then after that, I usually bring the patient back in 2 to 4 weeks. And then they usually come about every 2 to 3 months for booster infusions.
Good to know. A lot of people might have reservations thinking that this is something they'd have to do 3 or 4 times a week indefinitely. So it's good to see that there's improvement noticeable to where ongoing maintenance can be spread out a little bit more.
Yes. And some patients can go a little further than others. And I have some patients who have to come monthly, but the vast majority and median of patients come about every 2 to 3 months.
I guess location and setting, you made it clear that you provide a very safe environment for them. But for people who have less mobility, we'll say, are there accommodations that are made for positioning and general, like if someone's wheelchair bound or they need assistance maneuvering, are those accommodations made pretty easily?
Absolutely. I do have recliners here. The recliners are lift recliners. So that is also not only for the patient's benefit, but also for our benefit. So we're not lifting and pulling on patients. They will actually stand the patient up to make it easy for them. I do have a wheelchair here. We have a walker here. My nurse and I both assist the patients to their cars if they're having, a little bit difficulty of walking. And, making accommodations for a patient is no problem. I have extra pillows to make them comfortable. I have pillows that actually go on the bottom of the recliner to help them be comfortable. If they need help turning on their side to be more comfortable because they don't want to lay on their back, those kinds of things. We also have fireplaces in all the rooms. So if they're a debilitated patient and they tend to get cold, I will turn the fireplace on in the room. That way they're nice and warm and they're comfortable. We have weighted blankets as well as regular blankets to keep the patients calm and also keep them nice and warm. So anything that a patient needs, I would be happy to accommodate them to make them feel more comfortable.
When you spoke about the initial appointment or the consultation, would you do a treatment immediately after, or would that be scheduled?
If I have the availability and the patient is eager to get started, I can do that, and I will discuss that with them typically on the phone before they come in. But typically they come in for a consult, and then I get them scheduled after the consult. But I do have some patients who are very eager and they want to start immediately after the consult, and I will try to accommodate that.
Yes. And also with the patients that you see, is there anything that you provide guidance to them on furthering the treatment effects when they get home, when they leave your facility? Is there things that they should be doing on a daily basis to ensure that, first off, they're going to be compliant with the treatment, and second, that they're going to see the benefits more readily?
Yes. One of the biggest things is if they do not have a therapist, getting them into therapy. One of the most frequent things that I see is that patients have a difficult time, and myself included, coping. And so when life stressors happen and they start to add up, they're not able to manage or cope with those. They also complain that they have hit a wall during therapy and they can't go past that wall, whereas ketamine will help open up those doors so that they can get through that door, get past that wall so that they can make more progress in therapy. But therapy is the number one adjunct to ketamine for success for a patient.
I haven't done the ketamine route yet, but when I speak to people in the chronic illness world, and specifically, I speak to a lot of people who have had mesh implant illness. So whether that be hernia mesh, which was my case, and there's also the breast implants, there's also joint replacements. Those type of patients that deal with chronic pain, they also have that emotional component from the surgical trauma and the lack of medical care, we'll say in the traditional sense.
And I do think a lot of patients have PTSD from seeing multiple providers.
Absolutely.
And feeling like they're not heard.
And so the therapy component, which is often it is recommended, primary care can only do so much. So they do recommend the therapy, but it's not generally well-guided therapy. Most patients don't know about your type of practice, for instance, and they only seek help for coaching, like lifestyle coaching, which is very important too. That's an important piece, but I guess it needs to all come together. And for those more complex cases, we don't want them sitting in the state they are without hope for improvement. There's a line that sometimes is drawn, whether it was a 1-year thing or something that's been drawn out 10, 20 years. I think that we need to be aware that there's still progress to be made. So this line of treatment is an option out there that not too many people are aware of. Just to give more examples on how you've seen effects for all the people with the chronic pain and lack of mobility, maybe regular life functioning, like what type of improvements have you been able to see and witness for yourself?
I literally have watched people's lives completely change. I have watched people who are so depressed they cannot get out of bed, they cannot function, and go from that to 6-figure jobs. I have watched high school students who are being picked on, being bullied, go from being almost completely debilitated to getting into college and being able to be successful. And it's unbelievable the things that I watch every day with my migraine patients who have 10 out of 10 migraines every single day for 20 years. And they come in and we do ketamine and they're like, Kelly, I don't have a migraine. This is unbelievable. I've never, ever been without a migraine. Or they tell me, my pain is a 1 or a 2. It's never been that. It's always been a 10. So we do offer ketamine-assisted psychotherapy here as well. That has been extremely beneficial for my patients who have hit a wall with therapy and they can't seem to get past it, especially my post-traumatic stress disorder patients. That is actually where we do a lower dose infusion and the therapist will sit in there with you. You will meet with the therapist beforehand and kind of come up with a roadmap or a guide before your infusion therapy session. And they will sit in the room with you and go over things and try to do a deeper therapy session to really get at the root and get to the root cause of the issue. And also try to come up with some coping mechanisms and strategies. And patients have been able to recall things that have happened in their past and talk about them that they have never been able to do that before. So that has been extremely beneficial and is an option as well. I typically don't recommend it in the beginning. My goal in the beginning is to get the patient stabilized and get them feeling better. So typically we load first. Then after a couple months where you're doing very well and you're stable, then I will bring you back and you'll meet with the therapist and we can do a ketamine-assisted psychotherapy session at that point.
That is an awesome option, especially for, again, people who either are hesitant to see multiple practitioners and they want to take one avenue of treatment and see if that's going to provide them the relief they've been looking for. So that's
right.
a wonderful thing that you have in your practice. As we talked about some of the things that your clients can do away from the office that you can actually integrate within your office, are there other things that you can suggest they do in terms of maybe lifestyle changes? I don't know if you even approach diet, but rest is so critical, making sure we have ample and sleep and good sleep hygiene. Whether there's exercise, stress reduction, of course, is like a main component here.
I think one of the biggest things is, healthy diet, exercise, and also getting enough sleep, especially for my bipolar patients. Sleep is a huge thing for them, and especially getting enough sleep to where they don't end up manic. So that is extremely important, taking your medications as prescribed, especially my bipolar patients. I try to go over with them at length about making sure that they take their mood stabilizers. Ketamine is not a mood stabilizer, unfortunately, and ketamine itself will not cause mania. However, if they're in a mixed state or hypomanic or manic state and they do infusions, that could put them into a full-blown manic state. So for those patients, I do spend a lot of time with them and make sure that they are getting ample rest, they are eating healthy, they are exercising, and all of my patients, and they are also taking their medications and how important those mood stabilizers are. But I think sleep is probably one of the biggest things, sleep and exercise.
Have you seen that some of your clients might have been able to taper down from their pharmaceutical interventions?
Yes. Now, for bipolar patients, they will likely never, ever come off of mood stabilizers. But I have had patients been able to wean off benzodiazepines for anxiety, opioids for pain medicine. I have had some being able to come off of their antidepressants. And that's something that we can discuss. I don't personally wean their meds. That would be between them and their psychiatrist or pain management physician. However, I usually recommend that they're stable for at least 3 months before even discussing changing medications. And I don't recommend any med changes at the time of doing the infusions, because then it gets really confusing. Is it the ketamine causing issues or is it the med changes?
Exactly. Yeah. Just one thing at a time and document how they feel. Keep a good diary. It's just like even onboarding supplements. You don't want to bring on more than one thing at a time.
Right. Correct.
Is there anything else that you would like for our listeners to know?
I think the biggest thing is I am very kind, very patient. I will listen. I don't charge anyone to come in and talk to me. So even if you're only considering this or looking into this or starting the process, please don't hesitate to call or come and see me and talk to me. I never mind doing that at all. And I want you to feel safe here and that there is no judgment here. I have all walks of life that walk through this door. And I want to make sure that no matter where you are in your life, that you feel safe coming here and talking to me.
You heard her, everyone. Reach out. And so how can people reach out if they'd like to either schedule or learn more about your practice?
They can go to our website at www.novel, N-O-V as in Victor, E-L, mind, M-I-N-D, center.com, or they can call me at 850-597-9732.
Thank you for sharing that. And as always, we'll put that in our show notes so that you can reach out, take a look at our website, see what she has to offer, and definitely keep this as a consideration in your next step of your healing journey. Thank you again, Kelle, for joining us today. It's definitely been insightful.
Thank you so much for having me. I appreciate you very much.
All right. Thank you, everyone, for listening. We'll see you next time.
Don't forget to subscribe to our podcast and also to our Instagram. Our handle is Functionally Enlightened.
Dr. Sharon Sarita is not a medical professional and is not providing healthcare, medical, or nutritional therapy services or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional issue. The information provided in this podcast is for the informational purposes only and is not intended to substitute professional medical advice, diagnosis, or treatment. Always seek advice from your physician or other qualified healthcare provider before undertaking a new health regimen. Do not disregard medical advice or delay seeking medical advice because of information you heard in this podcast. Do not start or stop any medications without speaking to your medical or mental health provider.